Everybody hi. In discussing an approach to a patient, this time I'll pay attention to the palpation. Palpation, as a component of a physical examination, is a method of manual and virtual perception of tactile properties of various parts and organs on the human body by the hands of a researcher or with the help of diagnostic equipment such as a virtual finger ultrasound machine. Palpation allows to assess the temperature, humidity, swelling, and other properties of the skin, evaluate lymph node for lymphadenopathy, size, shape, hardness, location, functioning, and even integrity, bones, muscles, tendons, joints, of various organs with the exact localization of established lesions. Palpation investigates arterial pulse at different levels, cardiac thrills, tactile vocal fremitas, abdominal distension, anocytes, hernias, condition, tumors, cysts, and so on. Profound knowledge of anatomy and daily practice is necessary to achieve high palpation skills. Manual palpation can be a light, fixture, and deep. Ordinarily, the patient is placed on his back, resting on his head and knees. They should indicate areas of pain to minimize discomfort during palpation. Light palpation detects tenderness and areas of muscular spasm and rigidity. Examiner systematically palpates the body regions by the flat part of one of the hands, but not the fingertips. The fingers combine together. Fixture palpation lets feel for surface abnormalities, texture, tenderness, temperature, moisture, elasticity, pulsations, and masses. Examinator depress the skin up to 2 cm with finger pads with a light touch. Light and fixture palpation let recognize fields of crepitus, sign of air or fluid within the subcutaneous tissues, irregularities such as lipomas, scars, hernias, tenderness as a result of inflammation of the underlying organs, and even acute perforated ulcer, spasm or rigidity, signs of underlying inflammation like appendicitis, and so on. Generalized tenderness of the abdominal wall often signs generalized peritonitis. Deep palpation under the support of deep breathing uses for intra-abdominal structure investigation. It lets feels internal organs and masses for size, shape, tenderness, symmetry, and mobility. The technique applies to every one quadrant of abdomen and leads to study properties of the liver, gallbladder, spleen, intestine, bladder, kidneys, uterus, and uterine appendages in women, pathological formations, sites including. Technique helps recognize hepatomegaly, hydrops of the gallbladder, carcinoma of the head of the pancreas, pancreatic, gastric, and colon malignancies, appendiceal abscess, the kidney cyst or tumor, retroperitoneal structure, lymphoma, sarcoma, and pulsative masses, aortic aneurysms. Besides emphasized points, manual palpation uses for positioning of particular pieces of equipment, electrocardiography, electromyography, and electroencephalography electrodes, echo camera sensor, stethoscope head, visible landmarks in motion analysis of body surface, scanning, etc. Virtual palpation in its different forms, elastography, stress imaging, etc. mimics manual palpation due to use ultrasound or magnetic resonance imaging and lets to evaluate tactile, elastic properties of organs and tissues deeply situated in the human body. Do not forget that qui bene diagnosticit, bene curat.